Hello, NASPA conference attendees. Thanks for attending my presentation. My name is Ahyoung, a PhD student at Louisiana State University. In this video, I'm going to present a study conducted with my advisor, Dr. Kuznetsov, titled The Effect of Different Precision Demand and Visual Focus on Upper Limb Joint Kinematics and Muscle Activation during the Object Transport while Walking. Transporting an object while walking is one of the most common activities individuals perform every day, such as carrying a cup of coffee or a cell phone. During walking, the trunk typically displays sinusoidal patterns in sagittal, frontal, and transverse planes, all of which produce inertial forces. Previous studies have found that the stability of the upper limb and the object can increase by modulating limb stiffness and damping via altered muscle activations as well as continuous and predictive control of grip force. In addition, our recent study showed that the stabilization of the shoulder and elbow joints by anticipatory proximal to distal muscle activations also contribute to maintaining the stability of the object. This study is an extended version of our previous study in order to explore more determining factors on upper limb strategies for object transport task. So therefore, the purpose of this study was to investigate upper limb joint kinematics and muscle activation during the task with different levels of precision demand and visual focus of attention. In this study, we hypothesized that higher damping behavior and smaller relative elbow flexion angle with increased muscle activation will be observed during the object transport task with higher precision demand and when visual information is not available. 3 young healthy adults participated in this study. They were asked to walk on a treadmill at self-selected speed while carrying an object in their dominant hand. This figure indicates the object we used, that was 3D printed cylinder with curved top surface. They performed the task with high and low precision demands, meaning with versus without a small ball in a cup, and two visual focus of attention conditions, looking forward and looking at the cup. Kinematic variables include damping ratio, range of relative elbow flexion angle, and ball trajectories. Damping ratio quantified using vertical displacement of C7 and MCP markers. We also measured muscle activities in 10 upper limb muscles. So the results. Our results showed that both upper limb damping ratio and the range of relative elbow flexion angle were affected by different visual focus of attention and the level of precision demand, showing higher damping behavior when carrying the object with a ball while looking at the object. Higher damping ratio was observed during the task with the low precision demand, indicating greater displacement of the hand relative to the C7 or trunk. The range of relative elbow flexion angle was higher when looking forward in both high and low precision demands. The amplitude of the ball movement increased when looking at the object. The relative trajectories of the ball carried within the object was similar in vertical direction, but they increased in X and Y directions when looking at the object and the ball, producing greater area in XY plane. The EMG results showed that the overall increase in the muscle activation during the object transport task when compared to natural walking. More specifically, during the task with high precision demand, participants showed higher muscle activations in all the upper limb muscles when they were not allowed to look at the cup and the ball. While during the task with low precision demand, participants showed higher activations in 6 muscles when they were allowed to look at the cup. From the results of this study, we found that both task constraints and different visual focus could affect upper limb kinematics and kinetic characteristics. Then how do participants adapt to the increased constraint? The results of this study suggest that one of the potential strategies to maintain the stability of the upper limb and the object is to minimize the change in elbow flexion angle, especially when the level of perturbation increases. Also, higher levels of co-contraction observed through the increased level of activation in most of muscles could be another strategy used to maintain stability of the object when visual information is not available and higher precision demand is required. Further, research should be focused on collecting more data with larger sample size and to examine patterns of EMG covariation using non-negative matrix factorization. This future study will provide more information on the understanding of neuromuscular control strategies during the object transport task with increased demands on control of the object orientation. If you have further questions regarding this study, you can find contact information at the bottom of the slides. Thank you for listening to my presentation.